Hi, I'm Dr. Emily Wroe, and I'm a global health physician, and I've spent most of my career living and working in rural areas on healthcare delivery, including here in Malawi. Almost 10 years ago, I met a young woman who lives in the hills behind me who came into the hospital in her second trimester of pregnancy in heart failure from rheumatic heart disease. We were able to work with the team here to connect her to surgery, and then she needed a clinic to take care of her for her treatment afterward. So around that time, we started a clinic for people like her, young people living with severe and chronic conditions where they need access to care close to their homes for their medications, a trained clinical team, and a connection to a community of people living with conditions like theirs, and avoiding the need to travel to large urban areas for care. Since I met that young woman, I've met many young women and mothers of young children living with these severe chronic conditions. And in fact, over those mountains behind me, if you go farther, is Mozambique. And one of the first patients I met there was a young woman who also happened to be pregnant, learning that she had type 1 diabetes for the first time. So I'm fortunate enough to be working with 14 countries on this clinical program and with a global network. I'm the director of the clinical program, and my project focuses on bringing a gender equity lens to the network and to the clinical program, and I'm excited to tell you more.
The NCDI Poverty Network aims to address the diverse set of non-infectious conditions impacting impoverished populations, which remains a huge gap in equitable care today. The network is based at 2 universities, one in Mozambique and the other at my home institution at Harvard Medical School and Brigham and Women's Hospital. Today, there are 22 member countries working together on an ambitious agenda, which includes the clinical program I told you about, called PEN+. In my introduction, you heard about why I do this work and some of the people I've met with these conditions. You yourself may even know young people who have been impacted by type 1 diabetes, sickle cell disease, congenital heart disease, and more. And it is here where I focus my leadership project. To get started, I brought together many of my inspiring women colleagues and friends from around the world, knowing that if I created space, they would add great value to this work from a gender lens. I wanted it to be fun and creative, a chance to get to know each other even better, and foster an environment of mutual support. I knew, and this leadership journey has emphasized, that creative and passionate groups of women are amazing things to be a part of. Our challenge and our gift was that we had so many brilliant women we could invite to the group, we had to start somewhere. So the founding members consisted of people working directly with clinics, and we made a plan to continually expand as we went to foster inclusivity while also starting small and nimble enough to make some early impact and gain some trust and momentum. At our first meeting in September 2023, we got creative and brainstormed. Who are we? What should we be called? What are we all about? What do we want to accomplish? We came up with a lot of ideas, and after the launch, we all contributed to an online survey to finalize decisions. So I am so grateful and pleased to introduce the Gender Equity Leadership Forum for the NCDI Poverty Network. Our 23 founding members have objectives to proactively apply a gender equity lens to the network, to support the network to achieve equitable and dignified care for women and their families, and to create evidence while doing so, and to elevate the voices of women leaders. We also came up with a lot of priorities to address women and gender, focusing on how to support both healthcare workers as well as patients and communities affected by these conditions, while aiming for big vision in the policy space and continuing to always look inward at our day-to-day work and make sure we are considering gender in our respective organizations and the network's activities. I want you to hear today directly from a few of our founding members.
Hi, I'm Eve from Malawi, working as a technical advisor in the NCDI Mental Health Division. I'm very excited to be part of the Gender Equity Leadership Forum, and what I'm looking forward is mentoring young mothers and caregivers.
Hi everyone, my name is Mukobe Livia Chisunka, and I'm the project manager for the PEN+ Ciders. And I'm very excited, especially the fact that we will support the training of dignified care for NCD patients.
Hi, my name is Yolanda. I'm a family doctor and I'm working with PEN+ Mozambique, and I'm very interested in prioritizing women with health problem, and then also training them in things relating to their health. Thank you.
So that brings us to now, where we have 2 initial projects. 1, developing a training for all PEN+ teams around the world on respectful and dignified care, and 2, developing programming to support caregivers of our patients. I'm so excited to continue this work and to continue to learn and grow, and I know that together the network can have tremendous impact on women. I'm deeply grateful to WomenLift, my mentors, colleagues, and friends, and to the Leadership Forum, where we are just getting started. Thank you.